Breakfast Television. Thanks for starting your day off with us. And as we all know, as we get older, staying active is more important than ever. But being active can also trigger aches and pains. Sometimes that's pain in your joints that isn't due to just exercise, so it could be osteoarthritis. And here to tell us about how to know what type of pain you're experiencing and what you can do about it is family physician Dr. Ted Jablonski. Good morning.
Good morning.
Or Dr. J.
It's all good.
As your patients call you. Okay, so let's start things off with the difference between regular pain caused by activities and something that could be a little bit more serious.
So typically if you exercise, you might get muscular pain. So this is typically outside of your joint area, and that's normal. As you get more fit, you get less and less pain there. But this is, osteoarthritis is in the actual joint. So if you're talking about weight-bearing joints, it's usually the hip or the knee. And it's not in the major muscle group, it's actually right in the joint. And you might see swelling, redness, it might be warm to touch. That's usually a more serious pain.
Okay, why is it important to know what type of pain we're experiencing?
Well, typically with osteoarthritis, it's more inflammatory, and anything that treats more of inflammation is going to be more effective. It's just muscular pain. You just need to get more fit. You need to keep getting out there and doing more. If it's arthritic pain, you need to manage the pain better so that you can keep out there.
Okay. Are there markers to tell what type of pain is bad pain?
Well, there are systemic arthritis markers, which are, that's blood tests that can really tell you if the arthritis is outside of osteoarthritis. Osteoarthritis generally is a radiologic, so an x-ray finding that tells you how much wear and tear. That's a normal aging process, right?
Right, things that we need to accept as we get older. But you talk about the 3 M's to maintain, mobility and minimize the impact of pain and chronic pain in our lives.
So everything we sort of talked about is a little negative so far, right?
Right.
You know, we get older, we get arthritic, things start to hurt. But the positive is that we can actually combat this. And I do talk about 3 M's, so 3 rules. So keep your momentum, so you got to keep moving. So whatever that might be, and that's regular exercise done, so this could be a walk. If you have trouble with your joints, anything that has more impact hurts. So running is a great activity, but if you have osteoarthritis, it will hurt. Right. So something like walking is better. Swimming, a fantastic activity. Say gardening, cycling, something where you're not putting so much weight. So that's the first M, keep moving.
Yeah, I think that's a common misconception, right? Is that people think I feel pain, I should stop moving, but that's not necessarily the case.
In fact, it's probably the opposite. When you feel that pain, it's telling you need to move through it to keep that momentum going.
Okay.
So the second one is also to try to get some weight off and maintain that weight loss. So that's very difficult. A lot of people can lose weight, but to actually maintain it off is a real challenge. But that's, again, where motion and keeping exercise is really, really helpful. The third is don't be scared of medication, right? So we have now over-the-counter meds, simple analgesics, anti-inflammatories like Advil, arthritis pain, a new product to the market, excellent anti-inflammatory, which can really, really make a difference in reducing that inflammation so you can keep moving. Okay,
so motion, maintenance, medication, those are the 3 M's. Keep moving.
Keep you going, keep that momentum, and keep that, everything off those poor joints.
Right, and it's never too late to start, too.
No, absolutely. So it's much more, much simpler to keep things going than to start from scratch. So that keeping that momentum, again, back to that momentum. If you keep it going, it's easier to maintain that. If you let it slide and then restart, that's very, very difficult. And that's at any age.
Yes, absolutely, to start those new habits. And you mentioned swimming really quickly, but what are some of the other activities that people can do that are low impact?
So low impact, cycling is a fantastic exercise, very aerobic. You can get a great workout without putting a lot of harshness on your joints. Swimming is good. Walking, just brisk walking. Yeah. I mean, the worst is probably running, and I'm a runner. I love to run, but it has a lot of impact on the joint. So anything where you're not bouncing or just jarring. So a lot of the home gym stuff, elliptical machines are very effective if you like to be inside. If you're outside, probably cycling and walking is your best activities.
Okay, and of course, consult your family doctor if you feel the pain is serious.
Absolutely, because there are, we talk about over-the-counter meds. There are prescription meds that sometimes can be useful, or rehab. This is physiotherapy, chiro, massage sometimes come into play here.
Okay, fantastic. Dr. J, thank you so much for sharing those tips with us. Motion, maintenance, medication, those are the 3 M's.